Good morning, everybody, and our LinkedIn friends. Thanks for joining us today. So in follow-up from our poll, so Jala had posted a poll about content. She was asking if we wanted to, or y'all wanted to hear about med reviews, investigations, data, or program setup, I think is how she phrased it, or something like that. But med review one. So I have some lovely guests that are some of our rockstar med reviewers, and we're going to talk today a little bit about the process and things that we can learn and kind of launch off of for further content as we kind of explore med review tips, tricks, techniques. And yes, I did listen to you if you voted on my poll that said you prefer articles over videos. Sorry, we're doing video because I talk better than I type, but we will follow up with articles that you can read. So we're going to do a video anyway, even though you voted against it. So, ladies, thank you for being here today.
Thank
First
you for having us.
question. All right, can you tell me about a time when you got a review and it didn't give you what you needed? All right, Dee, I'm going to put you. Yep.
I was going to say I can take that one. One thing that I find problematic in review is when the sample doesn't give the information needed to support or to rule out the allegation. An example of that might be if the allegation is, let's say, improbable service times, and the sample pulled only provides limited billing hours per date of service, then it's unlikely that I would be able to substantiate or to rule out that allegation.
Okay, so I'm thinking from an investigator standpoint, we're looking at impossible day. I pulled a sample and I pulled a statistically valid random sample. And if my sample unit is not a date of service, which is different than most of the time that we would do a sample. So instead, right, you're seeing a bunch of visits across the scope instead of an entire day's worth of services. So therefore, you can't see if it's impossible or improbable.
Exactly.
Okay. Gotcha. So what can an investigator do better to kind of avoid that, to give you that ability to substantiate or refute an allegation?
I think one of the easiest and the most beneficial fixes is a collaboration with the medical reviewer and the investigator to kind of determine like what specific components or data need to be pulled in order to work that case.
Okay, so just reach out, just talk. Isn't
Right.
Amazing. Amazing how many things are solved with good communication. My very first case, a little impromptu story because that's how I roll. It wasn't my very first case. But one of my first cases, I remember my med reviewer, or I got my review back and was like, you didn't talk about my allegation. And it's because it was PT and I didn't sample by my member, so they couldn't see the progress of care. So they couldn't see if it was excessive services because I gave them like random chunks of somebody's visits instead of the progress over time. So been there, done that. I think most of us have made some of these pitfalls or mistakes. I think kind of on that, it's kind of a piggyback, right? Terry, what does make a review go smoothly versus what can cause frustration for the med reviewers?
I think, being my now and that documentation is like my big thing. So, I mean, ultimately, when you receive a medical record and the doctor has no cloned information and he's initialed and dated all of the reviewed sections, that would be awesome. But realistically, kind of in what we've been talking about so far is good resources, clear policies, knowing the hierarchy of the policies, the rules, the laws that we're going to be following. I mean, these are the foundation of the reviews. So once we know what the specialty is and the allegation is that we're going to be looking at, obtaining good resources is the easiest way to start off smoothly. As Deanna and you were just talking about, the review sheet, when it includes all the information that's necessary to perform a conclusive review. That way you're not having to search for the information or request information, but should you have to, again, as you guys were talking about, communication, collaboration with the investigator, the accessibility of them. Those are all the things that can help it go smoothly. And then on the frustration side, the opposite of everything.
Yeah.
Lack of policies, lack of access to policies, especially when you're looking at older dates of service. We know that post-payment reviews can go back a few years, and without having those older policies, we're not going to have as quality of a review. Then organization of the materials. So the biggest thing, probably medical records. you know, your review can have a couple of people, tens of hundreds of people. I mean, depending on how big the review is, what they're looking at. You know, if you don't have organization in the materials provided and the records provided, if you send one PDF with everybody on it, all the dates of service, versus sending each member separately with date of service orders. So that can be timely, be a timely factor in how we perform our review. And then also one of the other things is multiple lines of business in the review when you're having to change your thought process from Medicare to Medicaid to commercial. So those are some of the frustrations.
Yeah, makes a lot of sense. And I think, I tend to focus on my spreadsheet, making sure it has your diags, your proc codes, your units, that sort of thing. And there's a lot less focus, I think, as an investigator on the medical records. Sometimes it's like, oh, as they come in, but we all want our stuff done first. And it's like, well, where's my med review in the list of waiting, because we're anxious to get our case going. So I think really taking consideration of what you guys need to make it smoother and go more easily, benefits us all. Awesome. All right, Mel, you're up. So speaking of lines of business, we support a bunch of different clients across the country. So we have a varied geography as well as lines of business. But what are some of the pros and cons of supporting those multiple lines of business, geographies, health plans, et cetera?
The benefits of supporting multiple clients is that we have an opportunity to see how billing trends change in different regions and markets. Like Terry said, we support all lines of business. So we have to take all that information and we're able to utilize it and apply our knowledge to support client reviews. On the other side of that, I don't want to say unfortunately, because it's all good. You learn, it's the business, it's constantly changing. So even though you might have the same allegation or code, you really have to focus on the hierarchy of billing guidelines. It's possible an update on a policy will occur affecting the findings of our review. So as you are assisting a client, depending on what line of business you're looking at, not trying to say anything about COVID and how the guidelines change, you could be doing a prepay or a post-pay review. And it's up to you as the medical reviewer or the investigator to make sure you have the correct resources and the current guidelines, and make sure you're looking for information in the right region, because it's not like I ever applied an LCD from one region to another, because I would never do that. I don't make mistakes. So, that's just very important, because you want to make sure you are giving the best quality and efficient review and findings to the client. So sometimes it's a lot to, pull all that together.
Sure. I mean, it is nice that we are an industry of perfect humans, so that there isn't those mistakes that happen. Exactly. And there's no gray area in what we do, either on the data or investigations or the medical review. So we're really, really lucky to work in an industry that is that, black and white. Awesome.
Perfect. This is it's a perfect world to work in this industry. And, you get alerts when codes guidelines change. So, oh, look, that's changed. I should stop and focus on this and go in a new direction. Doesn't happen.
Yep, definitely not. All right. So it sounds like a couple themes: collaboration, communication, right? Which is like the number one theme of everything that we talk about all the time. It feels like sometimes.
Good relationships.
Yes, relationships. Yeah, I mean, even just we laugh, but if you're not comfortable, or if you're like, this investigator always gets a little snarky or lippy every time I call her, are you likely to pick up the phone and call that person? And vice versa. Are we likely to collaborate with our med review team if we don't really want to hear what you say? So having that relationship, that trust in place, I think is crucial. But so collaboration, communication, organization, I think is so important. The spreadsheets, the records, even just the naming, splicing those, I know is huge. Policies and conditions of payment. Each plan has different levels of aggressiveness as far as, what do they consider a condition of payment? Do you have to have an image for everything that says it needs an image, or are they a little bit more flexible in that? And then it sounds like access, whether it's access to people or resources, policies, whatever that is, just making sure that we have the appropriate resources.
I would agree.
Okay.
Yeah.
I agree. Yeah.
Yeah.
Great.
And just staying on top of everything. That's just what we do.
That's what we try to do. All right. All right, ladies, I think that's a wrap. That's it for
All right.
today, and we'll see if anybody listens to us if we do it again.
Yes,
Sounds
please
good to
do.
me.
Yeah, listen, we're great people. You're gonna love us.
Absolutely. All right, bye, y'all.
Bye.
Bye.